Hi, my name is Linda Okafor, and in this Week 10 Reflective Journal, I will discuss the goals that I set at the beginning of the semester. At the start of the semester, I set some specific goals for my clinical and academic development, and they include 1. Developing stronger therapeutic communication skills. I wanted to become more confident in establishing rapport and trust with my patients from diverse backgrounds. Number 2, improving clinical decision making. My aim was to enhance my diagnostic reasoning and treatment planning. Number 3, managing personal biases and emotional responses. I recognize that certain patient presentation might trigger emotional reaction or biases, and I aim to develop awareness and coping strategies to manage these professionally. I made significant progress in achieving these goals. My communication with patients has improved through practice and feedback, and I have developed more confidence in clinical decision making, though there is still room for improvement. Most importantly, I became more attuned to my emotional responses and biases, developing strategies to manage them, such as grounding techniques and mindfulness. Throughout my clinical rotation, I noticed feelings of discomfort and uncertainty when working with patients who had complex trauma histories or certain personality disorders. Initially, I struggled with my own biases, particularly around patients who exhibited manipulative behaviors or resisted treatment. To manage these feelings and biases, I practiced active reflection after each patient interaction. I reminded myself of the underlying reasons for patients' behavior and maintained empathy, recognizing that resistance or manipulation could be rooted in their trauma or fear. Engaging in discussions with supervisors and peers helped normalize these emotions and gave me a broader perspective. Anxiety and self-doubt were common, especially when faced with complex cases or difficult patient interactions. To manage these feelings, I utilized grounding exercises before patient interaction to stay focused and calm. I sought regular feedback from my preceptors and peers, which reassured me when I doubted my abilities. Practicing mindfulness helped me stay present during clinical encounters, reducing my anxiety about making mistakes. I gained significant insights into the importance of patience, active listening, and empathy in psychiatric care. Understanding that each patient has a unique story helped me become more compassionate and less judgmental. I also realized that self-awareness is key to avoiding burnout and providing better care. By recognizing my own triggers and addressing them, I can maintain emotional balance and be more effective in my practice. Reflective practice has not only enhanced my self-awareness, but also improved my ability to provide empathetic care. It has helped me grow as a student, becoming more open to feedback, and as a provider, helping me connect more meaningfully with patients. Personally, reflection has allowed me a better management of my own stress and emotional well-being, a critical skill in mental health practice. I plan to continue using reflective practice in my future work. Regular self-reflection will allow me to stay grounded, address any emerging biases or emotions, and continuously improve my clinical skills. Reflection provides a pathway for personal growth and ensures that I remain mindful of my strengths and limitations as a practitioner. I intend to schedule more time for reflection after particularly challenging patient encounters or at the end of each week, documenting these experiences to track my progress and identify areas for ongoing development. Thank you very much for listening to my reflective journal.